process that I would engage before my client is lying down ready to receive massage.
The undressing.
Okay, so the undress before I'm done. When I just
Change.
okay, so you've got that case history which you use a client form. What is that form for? Why do I need that?
Assessing your client.
Okay. So we want to assess if there's any indication or contraindication, anything wrong with the client. Okay. Get the client to sign it and agree to having a massage, and it's always good to explain to the client exactly why they're having a massage or what you're going to be doing, so there's no shock or surprise. All right. I'm fully aware I've got oil on the floor. Okay. Now you've got to be aware of that, because if you knock it over and you slip, okay, think about health and safety the whole time. Right. So I've made sure the bed is the right height. I'm standing in a calm, relaxed way because I have to manage myself. All right. So one hand on the top, one hand on the bottom. Before I even start, I may want to just warm up my body. Okay, so a few stretches, and we're going through the hold. Okay, and the hold is just basically so your client can get a feel of your pressure on the client's back. Okay, and we're going through. Take a deep breath in, and slowly breathe out. Look at the rhythm and pace that I'm creating. I'm getting myself into a pace. If I'm nervous, which could be the first time, and I'm saying, breathe in, breathe out, breathe in, breathe out, breathe out, what am I doing? Hyperventilating my client. Okay, it's not going to help me. Or if it's about, I'm not going to shout, but if I shout and go, breathe in, breathe out, I don't want to shock my client. So think about your language and communication. Once I'm comfortable with that, I'm going to just put the oil down on the floor for the time being. Hold the towel there, take it down, tuck it in fully, make sure it's well tucked in, and then straighten the towel. Now there are a number of ways of doing that. You can either take the towel down, or what you've possibly learned now is that you've started there and you move the towel down from here, tuck in, okay? And make sure that this is properly tucked in, because you don't want to be exposing parts you don't need to expose. And always make sure your towels are straight. Okay, that your client is covered. At this point, I would ask the client, is it okay if I loosen her bra at the back, because I'm going to be working on the client and just making sure. Oh, that's okay. Would you mind just slipping your hand down? Are you okay like that, Lisa? I would also ask Lisa if she's ever had a massage before I started. Okay. Now, before I start, what I do, make sure my hands are warm. Have any of you had cold hands applied to your back? And what do you do naturally?
Yes.
Right. Okay, so the whole idea is that we don't want to shock our client. Make sure our hands are nice and warm, so you're warming up. And I'm just going to go with that. And what I do, just a different way, is now with my eyes closed, I'm getting a good feel. So what am I doing now? Trapezius, levator scapulae, scapula, okay, coming down, erector spinae, rhomboids, latissimus dorsi, okay, coming around. So I'm getting a good feel of where these muscles are and what they're doing, okay? If she's lying like that, so I'm just going to ask her to tense up here. Would you make her? And I'm doing that, I feel, oh, okay. I wouldn't say to my client, whoa, okay. I would say, I would note in my mind, this is tense, okay. That could be an indication for compression, okay. So, I haven't handed out the technique sheet yet of what it is. I want to do it first, and then we're going to talk about it, okay, as a group. But what do you think compression does? You've practiced it. The technique you're going to learn today is called a compression, okay. What does it do? Okay, so we've applied pressure, okay? By applying pressure, I'm just going to do it blind. I'm just doing that. Look at this. I'm applying pressure, okay? Now, it's not deep. I'm just applying a pressure. If I just use my thumb, over time I might find that my thumb becomes, okay? So there's going to be different ways. But by applying pressure, if I take my thumb off, what does it leave? Did you see on that? What colour was it?
Red.
White initially, and then red. So what I've actually done, I've squashed everything, if you use that as an understanding, squashed everything and taken the blood out of it, in a sense. The minute I release the blood rushes in. Okay, so what we're looking for is any tightness, often called knots, okay? So, get a good feel, and then I'm going to apply oil into my hand and straight onto the client, and there should be enough oil, and then I close the oil, okay? So I start at the first stroke, put that there out of sight. Oops. And I begin to Apply my first stroke, which is a effleurage. Now you can stand there, or you can start over here and move up. Okay, so quickly. Then I could go into some kneading. And my journey here, everyone needs to be kneaded. Okay? So thinking about that, we're rolling, we're moving the muscle. So what is the effect of these two other strokes? Why are they being done?
Circulation.
Okay, so now I'm looking at warming up. Okay? So I'm getting the area warm. And what I'm going to do, just for the first demo, is show you a few of the compression techniques up here. Okay. So the first thing, I'm warming up, and what I said, I'd like you to practice with your eyes closed. Okay, so I'm getting a true sense of how this muscle's feeling. Okay, so now I can form a little cup, my hand, and with my fingertips, I can start to apply pressure downwards. Okay? Now there's two strokes I'm going to show you. The compression, which is more static, it doesn't move, and another one where you can move with it, which is known as friction. Okay, so compression, fairly static, so this is with fingertips. And what I'm using, the pads, my fingers. So start up there, I can move it down slowly, along the erector spine if they were tight. What happens if my client starts moving, go,
Too much pressure.
okay, what would I need to actually do that? Burst into tears and cry? That's not fair. No? So what do I do? Okay, I'm going to have to go back and reassess. This is not warm enough. Okay, it may still be cold. So what I'm doing is actually shocking. So if it is cold, I'll go back. You can knead more. Okay. I often use the palm of my hand and smooth out. Okay. And what I'm doing, what I'm trying to do, as I said, is see through my hand. Now I'm trying to find tightness. I'm trying to find the P. Okay. I'll find it. Okay. I have to be aware that that is a P and it's not a rib. So the next thing, if I crash, crunch, I'm sorry, okay? So be aware of that. That's why anatomy is so important. You have a field map now, an imagery, exactly mapping out where everything is. For example, I'm on a rib here. If I do on this, so I can show you anatomy in motion, look at this, can you see there? We said, how would we be able to access subscapularis? What do I do? There, onto that, okay? Now if I start applying pressure and pushing to that now, it's going to happen here. Okay? It's not warm, so this is an awkward way of working, so there's a better way of working. But there's different ways in which we can actually place the body to access the muscles. Alright, so knead. What I want to do is make sure it's really warm, okay? So what I'm doing is friction now with the palm of my hand, supporting the scapula and moving towards the shoulder. And if I wanted to increase the heat, I could go a little bit faster, okay? But keeping contact with the palm of my hand. Back into a knead. And then with my eyes closed, really feeling for tight spots, okay? Once I find a tight spot, I can use my thumb, okay? I can use my other thumb on top to help it or support it. And what I do, I would always ask my client to breathe in, breathe out slowly, and as she breathes out, I would apply a downward force, okay? And ask her, what is that like? On a scale where 0 is no pain to 10 is a fair amount of pain, what is that like? And she may say, it's fine, or it's very sore. Okay? Once I feel that ease or release, I can go back, knead, okay, and smooth out again, working my way down. So the technique there, we can either use our fingertips to locate that. So remember, it's with the pads of your fingers, or with the thumb, or you're up. Assist your thumb, so you can put your hand on top and continue the stroke with your other hand on top. Draw uses a great example in his teaching about snooker. When you play, okay, you always have another hand there to help you and support. So at times, having a support allows you to control, and you mentioned earlier the pace at which you're working, okay, and allows you to guide along structures, okay. What other part of my hand would I be able to use to Is that useful?
No.
So maybe that would actually be useful as a smooth out, but I have to be careful.